Hi Norbert, it's good to see you again. And now I know you joined Foundations for a 10-week internship last summer to undertake a project focused on hoarding. So perhaps you can tell us a bit more about yourself and how you came to be working with Foundations as an intern.
Hi Dave, thank you, and it's good to see you too. So just a little bit about myself. I am 22 years old now, and I'm a fresh graduate from the University of Manchester. Um, Foundations was my second internship, actually. The first one I have done at the Food Standards Agency in Westminster, and I've received this opportunity through the policy bootcamp at my university, which basically taught us how to think about policy and how to get into this industry. And it was a very good opportunity, as at the end they offered this opportunity to apply to some of these policymaking internships, and I was lucky enough to secure myself a place. And I spent 10 weeks at Foundations overall, over a period of 3 months, where I had to carry out some research on hoarding best practice. And luckily I wasn't even alone, as I had Jasmine, my course mate from the university, who has done some research on dementia, which you can also find a past webinar about if you are interested.
Yeah, so that was back in February, I think. The Yasmin's webinar is on the Foundation's website.
Yeah.
Okay, great. So when people hear the word hoarding, many of us think this is simply about people who have too much clutter. Do you think that's accurate?
Yeah, in the sense that that's what hoarding is mainly about. It is, they have a lot of clutter, but I think the reason behind this clutter is misunderstood in the population. I think we need to understand that these people do not collect the clutter or the materials that they do because they just want to collect them, or they want to annoy us with it, or they're just dirty, so they're not able to clean up after themselves. I think these are all stereotypes that are not true at all. I think the reality is that behind most of these hoarding cases, there is a mental health condition. It was already recognized by authorities as well that hoarding is a separate mental health condition. And in many cases, there is a past trauma that sits behind the hoarding. For example, if a person lost a loved one, they might just dive into a deep depression where they are not able to clean their homes anymore. And I think we need to reflect on this in all the work that we do about hoarding as well. And I was quite sad to see that in some documentaries, especially in American documentaries, these people who hoard are often shamed for what they do or laughed at. I think we need to keep this conversation into a much more empathetic and professional manner. I think it's also very important to understand that people who hoard, in the 92% of the cases, have also an additional mental health problem. So it is a tool for us to see if somebody's hoarding, then they will need help with not only the hoarding, but probably with other mental health issues as well. Just to keep in mind to recognize this when we encounter a family member or a friend who suffers from this problem.
So it's a symptom of something lying underneath, which we need to get to the bottom of very often if you're going to successfully support someone with a hoarding tendency. So the focus for the project was looking at good practice in the delivery of service of people with a hoarding tendency. And we're going to hear about two of these services shortly. But what did you identify as some of the key elements in delivering an effective service for hoarders? And perhaps you could also tell us about some of the benefits of providing services for people who have a hoarding tendency.
Yeah, so I think starting with the benefits, I think it's important to see that addressing this issue can have a very good effect on the person itself, as they will have a much more livable house, a much more livable life overall. But also it has many benefits to the system surrounding them. For example, if a property is hoarded, then that is going to prevent other types of social services to be carried out, for example, repairs, and that can cause the property to go into disrepair quite quickly. It also it is also a huge fire hazard in the sense that if a property is hoarded, it will be quite difficult to put out the fire, and in many cases it is the cause of fire actually. I think also a quite important thing that it can attract crime, as if the property looks hoarded, then people might think that it's abandoned, and they might break in because of that. So that just overall decreases the security in the street as a whole as well. And I think one of the main benefits for local authorities could be the prevention of bed blocking, which is the phenomenon when a hospital cannot discharge a patient because they're not safe to let live in their homes, or even it will just cause readmission to the hospital, and that is a lot of money to upkeep.
Right.
So in terms of providing an effective service, I think local authorities need to first identify the seriousness of the case, and there are some very good materials for this. For example, the clutter image ratings that categorizes different levels of hoarding according to the seriousness and whether there is a need for intervention. It's important that we do not push ourselves into the lives of people who just have a minor issue with this. So in terms of the services that local authorities provide, we have collected some essential mechanisms and learnings that we've collected that are an essential service must have. One of this is, for example, is a specialized hoarding service at the local authority with a dedicated caseworker who can coordinate the approach. And it is essential to have funding for the decluttering, and this is preferably to be delivered by a hoarding company, for example, Lofty Heights, who we will hear from later on in the webinar. And then it is also essential to provide ongoing support to these patients. So one of the key lessons from the interviews was that if we do not provide this ongoing care, then in 100% of the cases, the hoarding will reaccumulate, and the patient will relapse to hoarding. So it is essential that we provide some form of ongoing support, for example, cognitive behavioral therapy, group therapy, or peer support, for example. So in order to uncover the hoarding cases in a local authority, I think it's essential to have good referral networks and well-maintained relationships, for example, with the NHS and the fire services, even with, for example, the census teams, to be able to identify these hoarding cases. That is one of the #1 challenges today in terms of hoarding, because I think we only know about 5% of the cases of the 1.2 million households that have this issue in the UK. So it is certainly essential to be able to identify them. And then we also identified a couple of key strategic, or not really strategic, but practical advice for the people who are working on the field with people who hoard. And some of these are, for example, to explain the client or the patient the possible implications of not cooperating with a non-compulsory service. As in many cases, if the situation gets too bad, then the local authorities and other statutory services will have a compulsory intervention, and that is going to lead to trauma and a not very good outcome for the person. I think it can also be very helpful to offer to donate the valued items and the collections, as people who hoard really value these items. That's one of the reasons why they can't really get rid of them and why they collect them in the first place. So we need to let them know that they go to a good place. They just won't end up in the trash, because that would really deter them from agreeing to cooperate. I think it's also quite useful to recognize that most of these people are much more willing to accept help from the third sector than statutory services. So that's why it might be better to go for a specialized third sector hoarding company. And it is also, in terms of when we are carrying out the decluttering, I think it's quite important to do it over multiple days and possibly in small themes, even though that can be more expensive. But if the person feels that they are in charge of the situation, they know what is being thrown out, then they will be much less likely to experience a trauma, and then the relapse and with the help of ongoing care won't be as likely.
So the assumption that you can just kind of get a skip, chuck everything out, and that's everything sorted is far from the truth when it comes down to providing an effective service, which is going to get to the underlying cause of the issue. That just deals with a symptom, and if you do that, very often you're going to see the person again in 6 to 12 months when they've once again started to accumulate stuff, which I think is a recognized problem with where that approach is taken. That's really interesting. So, and what clearly your view is that specialized hoarding services with dedicated resources working in a multi-agency context are really helpful. It's obviously not as simple as that all the time. So some of the key challenges, did you identify any key challenges in developing and delivering support for people with a hoarding tendency?
Yeah, I think we found in the interviews that funding is the #1 issue. So in many cases, the funding is only for a couple years, and it's not really something that the local authorities can build a lasting and effective service on. So it is, I think, really important for the local authorities and even for the government to understand and recognize this issue and address it with a permanent and effective service. I think I've been mentioning some of this already, but I think identifying the cases is very difficult because most of these people live quite normal lives, and it's not written on them that they suffer from the condition. So I think the effective referral networks are key for these cases to be uncovered.
Yeah.
I think we also need to address the stigma that is associated with this. That is a key challenge why people are trying to hide this condition, and they are not asking for help because it is stigmatized, it is shamed in society. And I think, and then maybe the third key challenge would be to achieve a intervention or develop an intervention that would prevent relapse effectively. Even with ongoing support, in many cases, the hoarding will not be able to be stopped. It will only be treated. So I think that's a challenge for psychology and the people who are working in this field to come up with a solution that would treat this problem permanently.
That's really interesting. So, I mean, if you're going to develop an effective service, you need to have given quite a lot of thought to how you're going to deliver it, how you're going to identify people who are in need of that service, and how you're going to be able to sustain the service. Because as you mentioned earlier, very often it's not a short-term intervention. You sometimes have to work with people over an extended period of time to really tackle the root causes for them, which gives rise to a hoarding tendency.
Yeah, and I think also, in many cases, these hoarding cases are quite different from each other. So it might be, for example, that an elderly person just experienced some trauma and they got depressed and they are not able to clean their homes, which is not necessarily a hoarding case. That is maybe just their inability to deal with the clutter in the home. Yeah. Whereas in other cases, if people collect the materials and then are not able to dispose of them because of the emotional barrier, that might be a hoarding case that requires, for example, cognitive behavioral therapy. Whereas the other case with an elderly person unable to clean, it might be just an ongoing cleaning service that is required to tackle that issue. So we need to be able to differentiate between these problems and not just tackle them with the same solution.
I think that's a really important point to finish on there, actually, in talking about hoarding, that everyone is different and you have to have a sort of person-centered approach which looks at the needs of the individual, not assuming that everyone fits into a certain model. Which always makes the delivery of any of these sort of services quite challenging, but it means the rewards are that much greater when you can achieve those positive outcomes for people. That's a really useful kind of summary of the report, Norbert. Thanks very much for that. And just to finish up back with you again then, so you mentioned that the internship lasted for 10 years, sorry, 10 years,
Would have been nice.
10 weeks last summer. When you graduated from university. So what did that lead on to, and what have you been doing since you graduated?
Yeah, so when I finished the internship in September, then I jumped right back into looking to get another job, and this was a 3 months period of submitting lots of CVs and attending many interviews. And after 3 months of trying, I managed to get a job at a place called the Cheshire Warrington Local Enterprise Partnership, which is a great place to work at. And my current job is really inspiring and fulfilling, as I am charged with supporting the sub-regional Sustainable and Inclusive Growth Commission. We're trying to decarbonize the industry in Cheshire and make it more inclusive. So it's a great purpose, and I really love the day-to-day job associated with it. And also in the same time, I am able to use my quantitative skills as I'm providing data for the sub-regional leaders to monitor the recovery, the economic recovery and societal recovery from COVID-19 and Brexit as well. So it has been a really great 3 months so far working at the lab, and I'm looking forward to continue to do it until my 1-year contract ends.
That's brilliant. And I should say that for everyone listening, that you got a first when you graduated from Manchester last year, and since then the internship and your current job is all being undertaken from Budapest, where you live. So you haven't actually been back in England for quite some time, but I think you're hoping, and you're hoping to return again shortly to kind of carry on with some of the work you're now contracted to do. Brilliant.
Exactly.
Thank you very much, Norbert. Great to see you again, and really good to hear from you and to hear what's going on in your life now. So thanks very much indeed.
Thank you very much for inviting me, and thank you for all the support provided during the internship.
It was good to work with you. Great. Thanks very much.